At the end of the war, Alberta medical graduates returned home from armed service. Many wanted to pursue specialized training, and in the 1950s, the Department of Medicine created the first graduate clinical training program. In the post-war decades, the quest for knowledge was enabled by new technologies, therapies, and specialization. In the Department of Medicine, 10 divisions in adult medicine were created. 2 Canadian medical firsts occurred at the University of Alberta Hospital in the 1960s. The first artificial kidney or hemodialysis procedure in 1962, and the first cadaver kidney transplant in 1967. The establishment of the Alberta Heritage Foundation for Medical Research in 1979 led to a rapid growth in the department's research capacity.
4 women in my graduating class of 63, and there had been 4 in my mother's class of 33, so over 30 years, no change. But after 63, the numbers of women increased very rapidly. By the early 90s, I think, at least 50%, and I think probably more now.
Prior to the AMHSP, the Academic Medicine Health Services Program, the Department of Medicine had what we call a practice plan, more of a partnership set up among the physicians within the department to share income duties. And that was the precursor, really, to the AMHSP. I remember speaking as a new faculty member in favor of that. Then came to a vote as to whether people would create this and be part of it.
We've had several advantages in Alberta. The first would have been AHFMR. That started in the 1980s. The second has been the evolution of alternative funding plans so that we could bring clinician scientists and clinician educators to Alberta in a way that almost no other province could.
I worked at the time with the program director, and I was very fortunate to be able to actually sort of build this role from the ground up. They kind of gave me a lot of runway and leeway, and that's how this position and the current structure of our Office of Medical Education actually came about. At least half or 3/4 of the Department of Medicine are actually previous residents in the program. It's so rewarding when you look out and you see all the staff, and almost all of them are previous residents.